Hi, I'm Dr. Shaktinag, and today we'll be discussing about deglutition. So, when you talk about deglutition, there is a voluntary phase and an involuntary phase. The voluntary is something what you do with your own volition. You do something by yourself, and because of that, some involuntary phenomenon is going to go in the next stage. So that involuntary stage happens in your pharynx, then followed by your esophagus. So there's a voluntary phase, involuntary phase. Involuntary happens in pharyngeal and esophageal. Okay, so when you take your food into your mouth, generally once it reaches the pharynx, it has many options to go through. What you would want is for it to go through your esophagus. Okay, so you would want it to go through the esophagus, but there are other options, like it can go up through the nasopharynx and go out, or it can go through your trachea. Okay, you can go through the larynx and trachea and then end up choking you. It can also go back the same way it came through. It can go out through the mouth. So these are various options through which your food can go through at this point. So the whole point of deglutition is to make sure that this that we just told you does not happen, and it goes only where it is intended to go. Okay, so first thing that should happen is the tongue should go upward, oppose itself against the palate. Just make sure that food does not go out through the mouth. Then your soft palate, this is the hard palate, this is the soft palate. Soft palate should go and oppose itself against your posterior pharyngeal wall. So once that happens, food can no longer go into the nasopharynx and regurgitation through the nose does not happen. Then again, your pharyngeal arches, the tonsillar pillars over here, kind of constrict. So this kind of happens to make sure that only properly masticated food goes through, not large chunks that can end up choking you. So only properly masticated food goes through this. And after that, your epiglottis obviously is going to shut your entry into the trachea. Okay, so the epiglottis is going to make sure that it's not going to go through this. So finally, what we have is your esophageal opening. Now the larynx as a whole is going to move upward and anteriorly. So this movement upward and anteriorly is kind of going to, stretch the esophageal opening and make it open. So this kind of increases the probability for food to pass through esophagus. That's all we're doing. So we're reducing the probability for it to go through other points and increasing the probability for it to go through esophagus much more. Okay. Next, what is going to happen is the food is going to go in through the mouth, lips are going to part, it's going to reach the oral cavity, and mastication takes place, salivation takes place, all that things happen, and the person is going to voluntarily roll the tongue backwards. So when the deglutition starts, that is the first thing that happens. You have to close the lips voluntarily, you have to make your tongue roll backward and put the bolus backward. Okay, so that is the first stage that happens. That is a voluntary phase. The voluntary phase happens inside your oral cavity. Now when this happens, the food particle which you just pushed backwards is now going to go and hit the areas of your palatal arches and the palate. Okay, so there's this whole ring area over here. So when it opposes against the palate, this is innervated by the fifth cranial nerve, and the whole pharyngeal area over there, there's a whole ring of sensory innervation over here by ninth and 10th cranial nerve. Okay, so these are what are going to carry this sensation. So voluntary phase began, and that will result in an efferent from the fifth cranial nerve from the palate, ninth and 10th cranial nerve from the pharyngeal areas. Let's see what happens to this next. So from the fifth cranial nerve, ninth and 10th cranial nerve is going to go up. It's going to go, of course, to the nucleus tractus solitarius. From the nucleus tractus solitarius, it's going to go to the medulla and pons. So there are reticular areas within the medulla and the lower half of pons. Okay, so there's medulla as well and the lower part of pons. Now from there, this is what is called the center. So this is the swallowing center, the deglutition center. This is the efferent. Now the efferent should go on to result in the intended activity. So this will go to the 12th cranial nerve. What does 12th cranial nerve do? Moves the tongue. So hypoglossal nerve to move the tongue, Ninth and 10th cranial nerve to move the pharyngeal muscles. Fifth cranial nerve to move the palate. So earlier we had discussed how things happen. Your soft palate should move back, oppose itself against the posterior pharyngeal wall. So for that, your fifth cranial nerve should act to move the soft palate. Your tongue moves up, opposes itself against the palate to make sure food does not go through that way. For that, your 12th cranial should act. Then your tonsillar pillars, okay, and the pharyngeal arches, the larynx moving up, epiglottis moving, and your vocal cords constricting, closing. So all this should happen, and for that 9th and 10th cranial nerve is there. Okay, so this is generally what you should understand with regard to the efferent, the center, and the efferent. Now, this is the value that is given in guidance textbook, even a boron, and I even looked at a few articles and pretty much like this. In Ganong, however, there's a bit of controversy. Okay, they mention this to be the 7th cranial nerve. They say that the 5th cranial nerve is there and 12th cranial nerve is there. Apart from that, efferent is through the 7th cranial nerve. Okay, so I'm just putting it out there for you to make an informed decision. Okay, Ganong is mentioning it like that, but it would make more sense actually to go for a value like 5th cranial nerve, 9th and cranial nerve, and 12th cranial nerve. And we have references like Guyton, Boron, and many other articles as well. Okay. Okay. So apart from this, another thing you need to understand is when this efferent is coming and swallowing has to occur, a part of it goes to your respiratory center to inhibit it. This is kind of very important. It goes to your respiratory center to inhibit it. So this makes sure that while swallowing, you do not respire at the same time. So this, regardless of which phase it is, whether it is inspiration or expiration, your respiration is going to stop shut. So this is what it does. So this is very important, and this is regardless of which stage of respiration it is. Okay. Yes. So you can see this diagram over here. The food is coming, and through the trigeminal nerve and the glossopharyngeal nerve, it goes to the swallowing center in the medulla and the lower part of the pons. And from there, efferents are going to go through the 5th cranial nerve to move the palate, 9th and 10th cranial nerve to move the pharyngeal muscles, and of course the 12th cranial nerve to move the tongue. Now, pharyngeal stage has begun. All those things that we had dealt with earlier took place. After that, there's something called esophageal stage. Now, esophageal stage, there's something called the primary peristalsis and a secondary peristalsis. So this primary peristalsis in the esophagus is nothing but the continuation of your pharyngeal phase. So whatever events occurred in the pharyngeal phase, a continuation of that goes downwards, and that is your primary peristalsis. So that is how food moves down. Now this is secondary peristalsis. So this happens if the food particle does not move downwards with the help of your simple primary peristalsis. So in case through primary peristalsis it still does not go all the way and there's still food over there remaining, your secondary peristalsis comes into play. So this is through your stretch and through your enteric nervous system. We had discussed it in a previous video. So gut motility is your myenteric plexus. So through its intrinsic myenteric plexus, there is activity and secondary peristalsis starts. Also, apart from that, from your 10th cranial nerve, the efferents from here go to the medulla, and from the 10th cranial nerve, it goes down from the medulla to the pharynx through 9th and 10th cranial nerve, and again results in secondary peristalsis. Okay, so that is it about this. So let's just take a look at a few questions and apply what we learned. So what is the correct statement? Pharyngeal arches dilate. That itself is wrong. Pharyngeal arches don't dilate. They instead constrict during deglutition to make sure that only properly masticated food goes through. So that is wrong. Pharyngeal arches narrow. Yes, true. Soft palate moves away from the posterior wall. No. Soft palate should move towards the posterior wall and oppose it to make sure that food does not go into the nasopharynx. So that is also a wrong statement. Pharyngeal arches narrow, yes. Soft palate opposes against the posterior pharyngeal wall, yes. Larynx moves downwards, no. Larynx moves upwards and in front, and that stretches out the esophageal opening. So that again is wrong. So let's look at the last statement, which has to be the right one. Pharyngeal arches narrow, larynx moves upward, tongue opposes the palate, yes. Soft palate opposes against the posterior pharyngeal wall. So all are true. This is the correct statement. Next question. The efferent and the efferent carrying impulses to and from the medulla respectively are 5th, 7th, 9th, no. 9th and 10th, no. Okay, so these two are obviously wrong. 5, 9, 10, 5, 9, 10. C and D are showing 5, 9, 10. So this is right. So now to see the efferent and see which is right. So here it's showing 5, 9, 10, 12. So this is the correct answer. Here it's showing 5, 7, 11, 12. 11 is not involved in this at all. Okay, so 5, 9 and 10, 12. So this will be the right answer for this. Okay, so this is the next question. Which of the following statement is false? Myenteric plexus is involved in secondary peristalsis in esophagus. That is true. Yeah. During deglutition, the respiration is only stopped during inspiration, not expiration. As we had mentioned earlier, whether it is inspiration or expiration, your respiratory process shuts down. Okay, even if it's inspiration or expiration, regardless of it, your respiration should stop during deglutition. So this will be the answer. Yes, we just go down and see the remaining options. Deglutition center is in the medulla and lower half of pons. True. Pharyngeal phase of deglutition is involuntary. Okay, so that is also true, right? Okay.